right, as we know, getting the right amount of sleep is essential for both your physical and your mental well-being.
But for those who suffer from sleeping disorders, that good night's rest can be easier said than done. Joining us now with treatment options for people with obstructive sleep apnea, our ENT surgeon at UCSD Medical Center, Dr. Schalch, and patient Wendy Hallisey. Thank you both for being here today. We appreciate it.
Thank you for having us.
Talk to us a little bit about what obstructive sleep apnea is specifically.
Basically, obstructive sleep apnea occurs when the airway collapses during the night. So while we're sleeping, as we drift into a deeper stage of sleep, our muscles become paralyzed, and the throat muscles, including, start to collapse and obstruct the airway. And that's when you start hearing snoring that we're all very familiar with. That's basically the noise of the air trying to make it through an obstructed airway, until, of course, the airway collapses completely, it obstructs, and then the patient or the individual stops breathing altogether. When this happens, of course, during the night, the oxygen levels drop, and then our body sort of rouses up us into like a lighter stage of sleep, so that then the breathing can resume and the oxygen levels can recover. And as you can imagine, when this happens over and over throughout the night, this affects the body at multiple levels. It disrupts the sleep, it affects the cardiovascular system, and the cumulative damage that occurs from that, of course, can bring about all kinds of other health complications.
Wendy, tell us your story. You were one of, I don't know, 20 or 30 million Americans who are suffering from something along these lines. How did you find out? How's it affected your life?
Well, it runs in my family. My dad has had it for decades, and when I started feeling really sleepy, and my roommates back in, young adulthood said, you're making a lot of noise. Back in 2000, I was diagnosed, and CPAP just was not an option for me. It just did not work at all.
So what did you do?
Well, I tried the mandibular device, which is the mouthpiece that you put in, and it kind of pushes your jaw forward. And I ended up getting like gum recession and needing gum repair surgery, and it just wasn't working. And so I just stopped treating my sleep apnea and just, was really tired.
Yeah.
All the time.
All the time.
Ultimately, how are you getting by now?
I'm doing great.
I
had the surgery in July of this past summer, and I'm still getting the Inspire devices getting adjusted, but my husband loves it. No more snoring. I'm getting a lot of sleep. I'm nice and peppy for my second graders every morning, so yeah.
It changes your life in so many ways, just having a good night's sleep in general. I was going to ask, about the surgery, but let's talk a little bit about the symptoms and just really what people should know about what causes this.
Of course. Like I mentioned before, of course, snoring tends to be kind of what brings people in through the door. And then, like Wendy was pointing out, that sort of exhaustion and just being tired all the time, sleepy, almost like in a fog. You cannot just concentrate. I mean, we all have had a bad night of sleep, and you know how that feels like the next morning. Now imagine going through that night after night, and then every day being your reality. I mean, you just don't know any better after a while. And then add to that, of course, medical problems that can be associated with obstructive sleep apnea.
What are we talking about, like long term?
For example, high blood pressure, right? That's a very common underlying factor with high blood pressure, is precisely sleep apnea. And then, of course, as the problem has been present for a longer time, you start having issues with your heart, cardiac arrhythmias such as atrial fibrillation, which then increases the risk for more serious conditions, for example, stroke.
Any short-term issues with, like, not breathing a bunch of times during the night?
Yeah, I mean, certainly the inability to recover, and then that poor quality of sleep will affect your performance. And it actually increases other risks as well. For example, getting into a car accident or an industrial type of accident if you're just not awake and you're falling asleep.
So a lot of people have tried the CPAP machines and all the things, the mandibulars. Talk about the surgery that seems to have helped Wendy so much.
Of course. I mean, CPAP, of course, is first line of treatment, and oral appliances can be very useful as well. But the reality is that there's no sort of one-size-fits-all approach. And in certain cases, CPAP or oral appliances might not be the solution. And now, thankfully, we have a technological advancement and a technique that will keep the airway open without the need, for example, with CPAP or an oral appliance. And that's what this device does. It is surgical in the sense that it needs to be implanted in the body. Like, Wendy went through the surgery, she had it implanted, as you can see there. But what it accomplishes is keeping the airway open by stimulating the muscles that you already have. In other words, you're not modifying the anatomy or removing structures or doing anything like that, but instead strengthening and keeping the airway open by stimulating your own muscles in your airway, and then allowing you to do the breathing and do what you're supposed to be doing.
Is this a lifelong implant?
It's meant to be, yes.
Yeah.
Obstructive sleep apnea, unfortunately, is a chronic condition. There's no cure for it as such. So you can manage it over the lifetime of the individual. But just like a pacemaker or other implantable devices, it's meant to be in the body basically for the duration
Is the
of the
technology
individual.
changing fast where like in maybe 10 years, this will be outdated or this won't be what is capable of down the road?
That is certainly always a possibility, right? Technology, including implantable devices, continue to evolve and progress. This is as state of the art as it's going to be at this point, right? This is the most advanced technique that we have. And if there ever was, let's say, a better device or an upgrade, that's a possibility. It can be upgraded. The battery needs to be changed eventually, about 10 years after implantation, and that can potentially provide the opportunity to, get an upgrade or a more advanced device at that point.
All right. I know my producer wants me to get going here, but is there a reason why there are so many people who are diagnosed with it?
Well,
is there something we're doing, or is it genetic, or is it?
It's a very prevalent condition, and now that there's more awareness, of course, we're testing more for it, we're looking more for it, and I think that's why we're finding it more. But there's other risk factors, of course, weight, our lifestyle, et cetera, that does contribute to it being more prevalent as well.
All right.
All right, thank you both for coming in.
Thank you for having us.
Come out and tell you guys I also have this. Found out recently, and my doctor came in. He said, if you were heavier, I would have expected this would all make sense. So it seems like lifestyle definitely contributes too.
It sure does, and certainly weight affects things, but obstructive sleep apnea is multifactorial.
Yeah.
So someone like you, can be also affected due to other factors, anatomy, et cetera, and that's why it's important that if you have the symptoms, get it diagnosed and do something about it.
Go for a couple runs. Thank you both very much.
Thank you.
Appreciate you guys coming in.
Thank you for having us.
Thank you both.